Hello, I'm Dr. Jordan Reeder.
And I'm Dr. Morgan Wimmer, and we are both third-year family medicine residents at Good Samaritan Medical Center in Corvallis, Oregon. Today we are presenting our project titled Substance Use Disorder, Knowledge and Perception amongst Family Medicine Residents at Samaritan Health Services. We would additionally like to thank Dr. Bharat Gopal for all of his assistance and advising throughout this project.
We'd also like to thank Olivia Pipitone as she helped with a lot of the data compilation as well as organization and editing. As residents training to become family medicine physicians, we were passionate about a project on substance use disorders due to its pervasiveness, as well as high morbidity and mortality in the United States and our community. We learned that almost half addiction medicine referrals come from the criminal justice system, while only 5.7% come from primary health care providers. We then decided to take a look at our own system and identify knowledge gaps for screening, counseling, and treating substance use among family medicine residents at SHS.
In order to assess these knowledge gaps, we provided an in-depth lecture on substance use disorders with surveys conducted prior to the presentation and 2 weeks after the presentation. We discovered that most residents did not feel confident discussing addiction with patients and did not know the medical management options for these individuals. We did find that our presentation improved resident understanding of medical management of substance use disorders with a p-value of 0.01. We also observed increased referrals to some of the lesser-known programs in our community. Most residents viewed addiction as a disease process rather than a moral failing before and after the intervention.
Our study was limited by a small sample size of 13 residents that completed both the pre and post survey, and then also we had a limited length of study for longitudinal impact. In future studies, we'd like to look at having earlier didactic sessions for substance use disorders, as well as look at having an earlier rotation for our family medicine residents in addiction medicine to help improve management as well as recognition and earlier referrals to supportive resources.